Okay, so ageist assumptions. Now, what I'd really like for you to do is just take a moment and just think of like the most common ageist misconceptions about older adults. What would those be? Often, it's around smoking, drinking, and drugging. I just want to remind folks that the proportion of adults who use marijuana in the United States is going up. These are statistics from 2018. Fortunately, there are no new statistics, but we know since the legalization of marijuana and medical marijuana that older adults are using marijuana more and more. The boomers and the vets, one of the largest two cohorts, generational cohorts, have the highest smoking rates of any U.S. generation. And yes, they are still smoking. One study found about 2.5 million older adults and about 21% of older adults hospitalized had alcohol-related problems. And sources estimate in 2020 that there will be about 4.4 million older adults struggling with substance use disorder. One thing that I always get frustrated with is the assumption that older adults are not sexually active. So this is a fun Red Bull ad. And there are seldom images of older adults being intimate or talking about sexuality and expressing sexuality. And as a provider, we need to be cognizant of the fact that this is a part of their human experience. Red Bull is a horrible product. Please don't drink it.
Red Bull, the drink that gives you wings.
So what matters most for older adults? Having sex and being sexually active and sexually engaged is absolutely one of those key things that matters most for older adults. You know, sex is not just about physical or penetrative sex, it's also about intimacy. And sex for a lot of older adults is really key to their relationships and the relationships that they continue to have. We know that sex has incredible benefits in terms of adding years to your life, improving your health and mental health well-being, alleviating stress, etc. But here is the problem in terms of ageism. The desire and capacity for sexual intimacy and pleasure for older adults, however, is often ignored or overlooked by general providers due to their ageist assumptions that older adults are no longer engaging in sexual activity or sexual risk behaviors. So there was a study done in 2017, the Let's Talk About Sex survey, done with the National Poll on Healthy Aging. There were some limitations with this study. It was online. 74% were non-Hispanic whites, only 10% were Black, and 10% were Hispanic. So representing the populations that we most serve was not reflected here. However, what is important to take away from this survey is that older adults are indeed sexually active. We know that sexual activity decreases with age, but still 46% among 65 to 70-year-olds are engaging in sexual activity. 65% reported an interest in sex, mostly men versus women, and about 73% of those that were engaging in sexual activity were very satisfied. It looks like it's not going to let me show this video, and I am sorry about that. It was a video on older women and their sex lives. It's a wonderful, wonderful documentary called Still Doing It, The Intimate Lives of Women in Over 60. And what it really gets at is that a lot of older women feel that they have to limit that part of themselves. But then they also realize that they have sexual yearnings and that's must be there for a reason. And so it's a wonderful documentary to basically address the ageism in terms of thinking of the postmenopausal woman as just being done. So, with this slide, I just wanted to say that, in terms of sexual dysfunction concerns, that this is another blind spot that a lot of doctors are missing. 50% suffer in terms of older adults that are sexually active. They suffer from a problem related to sex, but only 38% of men and 22% of women have talked to any physician about this. This finding comes from Dr. Stacy Lindau, who is a pioneer in terms of looking at gerosexuality, one of my heroes. And another thing that also years ago, and probably like between 2012, 2011, we saw a huge spike in STIs among older adults. And this rise in sexually transmitted infections is due to often generational norms regarding condom use, physical dysfunction, not being able to wear or maintain an erection with a condom. But it is absolutely an issue, and one that flourished because of ageist assumptions about people engaging in sex or high-risk sexual behaviors. There was a study done it was published in 2012, the National Health Interview Survey, and they identified low perceptions of HIV risk among older adults. The sample had over 12,000 respondents, and only 27% had ever tested for HIV. And of those who tested, only 70% of those who tested had been tested, were tested more than 5 years ago. 53% of those who tested said that it was suggested by their provider. In New York State, it is absolutely it should be standard of care to offer HIV and STI screens for older adults between 50 and 65, but also over 65. 89% of the participants in this sample said that their chances of getting HIV was none. And I just want to remind folks that in the mid-2000 teens, we saw a huge uptake in new HIV infections among older adults. And for an older adult to get HIV is a very, very different life, or I should say experience in terms of outcome. They don't have the immune system of a 29-year-old, which a lot of the long-term survivors in my clinic have, and it really does have a horrible impact in terms of their life expectancy and their ability to fend off infections. So I'm not going to play this video, but this was a wonderful video, a PSA that was developed with older adults in Florida. They identified that STDs or STIs had risen over 70%, and they created this public service announcement to promote it. Actually, I am going to show it to you because it's fun. So they're all basically doing Kama Sutra poses to try to help raise awareness that older adults are absolutely sexual, that they can get into all of these positions if they want to.